What do we know about the actual physiologic endogenous testosterone production? We know that it peaks at the age of about 18 to 22 years old. It is maintained up to the age of about 30 to 32 years old. And in a fourth decade of life, it has a progressive, gradual decline. And that progressive, gradual decline involves the total testosterone numbers and the free testosterone numbers. We're talking about from 1 to 1.5% of a total testosterone decline per year, starting from the age roughly of 32 years old. And we have about 1.5 up to 3% free testosterone decline per year. Although according to the recent guidelines from the American Urological Association, a testosterone level of at least 300 nanogram per deciliter, which is about 12 nanomole per liter, is acceptable for a man. Men with the testosterone level below 300 nanogram per deciliter or below 12 nanomole per liter are usually diagnosed, according to the modern guidelines, the latest guidelines, with a low testosterone syndrome. However, we strongly challenge this notion because the real practice shows that the actual asymptomatic range of a total testosterone is above 25 nanomole per liter, or above that 700 to 900 nanogram per deciliter. Okay, so with levels of total testosterone below 25 nanomole per liter, more likely a man to exhibit or develop any symptoms of low testosterone syndrome, when usually after the correction bringing up the total testosterone level to a level of 25, and of course the upper range is about 30, 31 up to 33 nanomole per liter, or 1,100 up to 1,200 up to 1,300 nanogram per deciliter of a total testosterone level is the maximal normal physiologic range. The slide 10 shows and talks about generational decline of testosterone, and there have been multiple studies done on that, studies done in different parts of the world. The most famous study was published in the year 2006-2007 by Trevisan. It talks about the populational decline in a serum testosterone level in the American continent, although there were studies done in Europe and other parts of the world. The Danish study is very famous because it's a high quality study. Journal of Clinical Endocrinology and Metabolism 2007, a substantial drop in men's testosterone level since 1980s was observed, with average levels declining about 1% per year. And we're talking about the decline of the average testosterone level in entire male population. And the population of those males involves men in a reproductive age. So on average, if say we compare somebody who is 60 years old in the year 2004 and in 60-year-old person in 80s, for instance in the year 1987, we have about 17% lower average testosterone number in men of the same age in different decades. A Danish study shows double-digit declines among men born in 1960s compared to those born in 1920s. These results indicate that recent decades have seen a substantial and as yet unrecognized age-dependent population-level decrease in testosterone level in men, potentially attributable to lifestyle, health and environmental effects not captured by these studies. So we can talk about it and discuss it on multiple levels. Well, as it turns out, and you can see that very well illustrated on slide 11, is that hypogonadism is not just restricted to the reduced libido or reduced sexual function. It also very much associated with occurrence and prevalence of metabolic syndrome, because low testosterone syndrome is also associated with insulin resistance, obesity, hyperinsulinemia, onset of diabetes type 2, hypertension, dyslipidemia, non-alcoholic fatty liver disease, a 3.7-fold increase in coronary artery disease, leptin resistance, increase in pro-inflammatory cytokines and adipocytokines, and also development of the negative feedback vicious cycle, in other words, receptor downregulation and loss of pulsatile hormone expression, and that is happening due to failure of the central mechanism, specifically hypothalamus-pituitary adrenal axis. There's plenty of evidence for that. The subsequent slides talk about it. For instance, sexual activity, erectile dysfunction, and incidence of cardiovascular events. And we have plenty of evidence showing that reduction of the total testosterone level is associated with a sarcopenia, tremendous loss of the lean muscle mass, plus increase in visceral and subcutaneous adiposity. While correction of the testosterone level or testosterone replacement therapy or any forms of effective hormonal optimization usually increase muscle strength and prevent from the rapid loss of the lean skeletal muscle mass, and prevents gains in specifically visceral adiposity. It also related to the increased bone density, usually via the estrogenic effects. So this is the indirect effect due to the conversion, or rather say more correctly, the aromatization of the testosterone molecule into the estrogen. And physiologically adequate levels of estrogen, they reduce osteoporosis significantly in aged men, plus other functions such as increased libido, erectile function, erectile and orgasmic domain, which are usually assessed by the International Index of the Erectile Function. There's more evidence